All right, welcome everybody. It's Doctor in the house, and I'm excited to be here with you, and I hope you're also excited to be here. And of course, if you're joining us for the first time, this is the show I like to call the consultation before the main consultation when you have to go to the hospital. So apart from, consulting, we also get to learn a lot of things about our health, learn how to manage some conditions, and even learn about new conditions and words that we've never heard before. We get to hear it on this show because sometimes those are the words you hear in the hospital. Anyway, we are still talking about diabetes, but today we are going to be looking at diabetes and cancer. Who would have ever thought? Diabetes and cancer. And now if you are watching and you have any questions, please remember that you can send the questions via the WhatsApp number on the screen, and the doctor will get to answer everything you need to know about diabetes and cancer. When I got this topic from my producers yesterday, I had to do some deep diving, and I realized that some people with type 2 diabetes actually have higher risks to certain cancers like breast cancer, liver cancer, pancreatic cancer, colorectal cancer, and endometrial cancers. Who would have ever thought? But Dr. Afriye Baidu, he's a medical officer at Violet Medical Center, will be here to break it down to us and, take us through the things we need to know and how to protect ourselves, or if you already have diabetes, how to manage your diabetes not to get to this stage. Hi, Doc. How are you?
Hello, I'm good. Thank you for having me.
Oh, that's nice. I love the energy that you've come with. And that means we're going to do a lot of learning.
That's why I'm here today.
All right. So, Doc, like I said, when I got this topic yesterday, I had to, do some deep diving because, like I said, diabetes is close to home to me, especially type 2 diabetes. So when I saw it, I'm like, okay, I need to read about this and maybe let the family know about some things. But now, let's talk about what is the link between diabetes and cancer. Okay,
so I'm quite excited to talk about this topic because a lot of people are not aware that there is a link between diabetes and cancer. Mm-hmm. So I'll first start off by breaking down what diabetes is. Diabetes is when there is uncontrolled blood sugar levels, and this can come about when a hormone that we call insulin begins to increase in the body, and due to it, they have different types of diabetes. We have diabetes type 1 and diabetes type 2. Right. So with type 1, there is impaired release of this hormone, and this hormone is supposed to drive sugar into our cells for use because sugar is the fuel of the body. So what happens is that when there is impaired release of this insulin, then it causes the sugar to increase. Sometimes too, there can also be resistance from the tissues, the cells, that would impair this sugar from going into it and causing high sugar levels. Right. So all these processes actually link diabetes to cancer. Wow. But before I proceed, let me just break down what cancer is in general. So cancer is when there is uncontrolled division and growth of cells. Right. And sometimes this uncontrolled division can form lumps that we call tumors, and sometimes can also disperse into other parts of the body, which worsens the whole situation. So what links diabetes to cancer is this high glucose level, this high sugar level in the blood. So this high sugar level causes damage to cells, and this continuous long-term exposure of this high sugar is what results that can lead to a higher risk of having cancer in diabetes. Right. Okay, that's one way. Another way too is this insulin that is being produced. High insulin has been linked to cell growth. So the more insulin you have, the higher insulin does in the body, the more cells are being produced, and it's also going to result in a higher risk of you having this cancer. And let's not forget, sometimes the processes that lead to you having diabetes, let me be specific, type 2 diabetes, the obesity, the poor diet, all these things too that can result in diabetes also have a risk factor of also resulting in cancers.
Wow. So basically your lifestyle.
Your lifestyle is also a huge part of what can also result in you having diabetes.
Wow, wow, wow. Now, you talked about type 2 diabetes, and of course we've learned that type 2 diabetes is actually lifestyle. It's all about your lifestyle. So it's a lifestyle disease. I don't want to call it disease or condition or whatever it is, but type 1 is autoimmune, and usually that's what the doctor told us here.
You're right.
Yeah.
Type 1 is autoimmune, where the body is attacking itself.
So with that, with type 1, are they also in risk of, say, cancer?
So type 1 has been shown to have a level of risk leading to cancer, but it's not as high as the type 2. Type 2 has a lot of factors considering, a lot of factors that can result in a higher risk. That is the obesity, the genetic component of it, the lifestyle, how you eat, how you exercise. All these things can cause a higher increase in the risk of having a cancer in type 2 diabetes.
Now, let's talk about the cancers. I named some, right? And most of these cancers, they seem like high-risk cancers. Tell us about, the type of cancers that are, open to anyone or can be linked to anyone that has, say, type 2 diabetes if they don't take care of themselves.
So there are a myriad of cancers linked to diabetes. We are talking about the likes of colorectal cancer.
So explain the cancers, So when you basically say colorectal, a lot of us just read it. We don't know where it is. So you understand?
Yes. So colorectal cancer is basically a cancer of the large intestines. So that is where food that's digested passes through in order to be released. When you have a cancer over there, it's called a colorectal cancer. You can have a type of cancer called pancreatic cancer, which is the cancer of the pancreas. And the pancreas is the gland that releases the hormone insulin. So you can also have a pancreatic cancer. And the interesting thing about pancreatic cancer is that if you have pancreatic cancer, even without the diabetes, it can even also lead to diabetes because the pancreas is responsible
for the insulin.
Exactly.
Oh, wow. Okay, so basically with that, sometimes you don't even have diabetes, but if you get a cancer on your pancreas, it can lead to type 2 diabetes.
Yes, issues with the pancreas generally can also result to a higher chance of you having diabetes.
So those ones are really linked.
Yes, there is a link because the pancreas is responsible for releasing the insulin. So when there are issues with the pancreas, typically you tend to have issues with your sugar levels with diabetes. Also, there is a risk of liver cancer also being having a higher risk in those with diabetes. Also, those to a woman too, there is an increased chance of having a cancer of the womb, which is called the endometrial cancer. That is also another way, and it's also been linked to increased chance of even having cervical cancer. Let me also remind you that diabetes reduces your immunity. So there is some
HPV.
Yes,
so obviously if it reduces your immunity, your body can't fight off HPV, which links to diabetes. You see, I'm a good student.
You are excellent. You should have gone to medical school. Exactly.
Wow.
Exactly.
Wow.
It's quite interesting how it works, and it's also been linked to breast cancer too. As you remember, these processes also affect insulin that results in increase of growth, and there's also an increased chance of breast cancer in type 2 diabetes.
Right. So with all this, one would want to know, okay, with all this, if it's seen early, can something be done about it?
So that is the point of medicine we are trying to get to, that we do early prevention, we do early detection, and as well as screening. So it's very important that
as a diabetic,
yes, as a diabetic, you go for regular screenings, regular checkups. I mean, if once a year is fine.
Okay.
If you can twice a year, it's fine. For the myriad of complications that are related to diabetes, you need to be checked. For a man, you also want to be checked for your prostate. You also want to be, there's a higher chance of having this cancer of the bowel too in men. So in women too, you want to make sure that you are checked for your breast, your womb, your cervix, everything. It's very important to be going for a regular checkup.
So let's talk about the women, like let's say older women, obviously, probably women that are menopausal. Do they still need to check their wombs?
Yes, so postmenopausal women would have to still have their...
Okay, postmenopausal, that's the word I wanted to look
at. Yes.
Because there's perimenopause.
Yes.
Yeah, and there's the post,
postmenopausal women should still be screened. They have a slightly increased chance of even having this endometrial cancer.
Why?
So
because nothing is working, like, it's, well, to the ignorant person like me, I'll think like, okay, I'm postmenopausal, nothing is working there, it's just there now. Why do I have the higher risk of even that?
Yes, because there are some hormone changes that occur when you are postmenopausal. These hormone imbalances and changes that occur are what increases the risk of you having these cancers when you are postmenopausal. So it's quite important, especially if you notice any symptoms, any abnormal bleeding during when you're postmenopausal, all these things. It's very important that you report to the hospital early, so that you are assessed, you are screened to make sure that there's no increased risk or anything going on that we need to be concerned about. So it's quite important, no matter your age, no matter your status,
to always go to the hospital.
Always be screened, to always be checked.
You need to go to the hospital at this point.
Definitely.
But off the topic, right? You talked about hormonal imbalance, right? At what point does a woman get more of the hormonal imbalance? Is it you know, at a stage where she's still making babies, or where her body can make babies, or is it at the stage of peri or post or menopausal? At what point does it get higher with the imbalance?
So with women, there are always some changes in the hormones day in, day out. With your menstrual cycle, there are always some changes that occur that even allows you, these hormone changes allows you to have your menses when it's your period. These changes also occur throughout your life, and even after you've had your you've ceased having your menses. So there is no specific points that we can say that it's high or lower, but there are always changes that occur over your lifetime. Right. It's just that it's been shown that when you are postmenopausal, there is a risk over there of having this endometrial cancer. But all in all, we always want to delve into ways of preventing all these. So being diabetic is very important that you're always being screened. It's very important that you take your medications, because as you recall, taking high blood sugar levels are what increases the risk of you having these cancers. And then you want to make sure that your weight is in control.
Yeah, I was going to ask you about that.
Yes, because it's been shown that fat has an effect on insulin resistance. That is, you not being able to utilize the insulin that's being released by the body. So it's very important to put your weight in check. What
about chronic inflammation? How does someone even know when they are inflamed? Because, like I said, I read a lot, and there's always this talk about chronic inflammation. What is chronic inflammation, and how is it different from obesity?
Okay, so chronic inflammation is basically an irritation going on in the body due to certain processes. So in diabetes, these high blood sugar levels, which are not the norm for the body, tends to irritate the body, and that's what causes this inflammation. So over a long period of time, we call it chronic inflammation. So when you've had this inflammation going on for a long time, it begins to disrupt how the cells goes about its normal process, and then increases the chance of you having diabetes.
But can I see someone that is chronic, like is going through chronic inflammation? Because obviously inflammation means like to inflate, like a balloon, to get big. So can I look at someone and know that this person is inflamed? Or only the eye of the doctor sees that I'm inflamed, he's inflamed, she's inflamed? Yeah.
I get why you might assume that a doctor might be able to see it off the top of the eye, but
because I get confused with also, you know, trying to differentiate, is chronic inflammation going to show like a person is getting fatter? How would the doctor know that this person is going through some sort of chronic inflammation?
So it's difficult to objectively see inflammation. We have to run some tests to know that there's something going on in the body. Okay, so in diabetes, there is that increased risk of having this inflammation, as I said, because of the high blood sugar levels that are going on in the body. So going to hospital is very important. Getting this regular checks, regular screening is very important, so that these things can be picked up early, because most of these things are asymptomatic. So when you are having these processes, when you get to the hospital, that's when these things can be picked up. So it's quite difficult to say that you are inflamed or you are not inflamed. Yeah, so that's why screening and early detection is very important.
Right. So there are people that are very against orthodox medicine, or say scared of orthodox medicine, and they'll prefer herbal and stuff like that. I know you're not into that, but does you know, taking diabetic medications, because usually they're on medications, diabetes, the diabetics are usually on medications, does taking that a lot cause cancer?
So
these are questions people will want to know.
Yes, definitely. So no direct link has been created to show that taking herbal medication will directly cause cancer, but there have been studies that indicate that taking this herbal medication whilst you have diabetes impairs the orthodox medications from doing the activities how they are supposed to. So you wouldn't end up having the control that you'd expect. So it's quite important that if you're taking any herbal medication, kindly consult your doctor about it, speak to your doctor about it, and that's why they are there, so that if they have an objection, if they have any issues, they can let you know prior to you taking any of these herbal medications. Right.
So you talked about diabetics going to the hospital. In fact, everyone should go to the hospital. That I think is very important, at least once in a year. But how frequent should a diabetic go to the hospital? And also, the last time Dr. Kelvin was here, he talked about, you know, yes, it's hard economically these days for a lot of people. That's why they you know, find it very hard to go to the hospital. But what if someone decides to go to the hospital? What are some of the most important tests or screenings that a diabetic should always look out for?
Yes, so
let's start with the frequency. How many times should they go to the hospital?
Yes, it's always recommended to be screened at least once a year. But the ideal thing is to go maybe twice a year. That is okay, to make sure that you're screened. For diabetes, actually quite a bit more frequent because of the medications they are put on. They will need to be checked to make sure that the medications are doing the work that they are supposed to do. If there are any changes to the medications that they are on, so that those will also be done. So for diabetics, they tend to go maybe every 3 months, sometimes go higher. It depends on the control that is being that's being done.
So if your blood sugar is controlled well, you wouldn't have to spend so much.
Definitely. I mean, it's once it's under control and that you're comfortable with it, you wouldn't have to go as frequently as someone whose blood sugar levels are spiking. Yes, that's the thing.
So are there important or let's say specific screenings that they should always go for?
So there are some. For a diabetic, there are also some tests you want to do for the body, because diabetes is a disease of the whole body. It affects the whole body in different ways. So you want to check the kidneys, you want to check the liver, you want to make sure that the heart is good in diabetes.
And we also had you have to check your eye. That's the one we learned last week, your eyes.
It's very important to check your eye in diabetes, because there is a risk of having issues in the eye when you are diabetic. It is a lot to take in, but it's very important that we do these checks so that these things are detected early, and also intervention can be made early.
I'm just here and I'm just thinking, it's really a lifestyle disease. It's definitely a lifestyle disease. Lifestyle in the sense that some people, when they talk about lifestyle, it's all about the jollying, you know, enjoying themselves, being out there and everything. You know, even rappers use it, and singers. Oh, the lifestyle. This is the lifestyle. It's really a lifestyle, because you're going to spend a lot. The lifestyle.
That's true.
Wow.
It is a lifestyle disease, because it's heavily linked to your level of activity, your diet, your weight, and things like that. So even to help prevent diabetes and the subsequent increased risk of cancer, it's advised that you take your lifestyle very seriously. You want to make sure that you are exercising. It's advised that you do at least 30 minutes of exercise every day, at least 3 times a week. Yes. And it's also advised to also cut down on high processed foods that are also high in sugar content, and to opt in more for a balanced meal that are rich in fiber, that are rich in vitamins, that contain whole grain meals.
Yeah, whole grain meals.
Yeah. And it's also advised that any habits such as smoking and alcohol, all these things, if you can stop smoking, that would be the best. If you can cut down alcohol, that would be ideal.
But when you say cut down on alcohol, like people like me like wine and champagne, right? But how many glasses does that mean I need to cut down on? I mean, I don't drink always, but I'm a social drinker. So if I need to say I'm taking care of myself, I want to cut down on alcohol, what does that mean for someone that's a social drinker?
Yeah, so what is recommended is that you drink at most 14 units of alcohol a week. That's quite a technical term, but
let's use wine glasses.
Yeah, so it's advised that you drink no more than 3 to 4 glasses in a week. So that it helps cut down on the alcohol levels that increase the risk of the diabetes and subsequently increasing the risk of these cancers. So it's always an important thing to cut down on alcohol intake.
Right. Okay, now there's one thing I haven't asked you. Treatment for the cancers. How does having diabetes actually affect the treatments for diabetes? Obviously, when you have cancer, sometimes they tell you need to do radiotherapy, sometimes they tell you we need to go through a lot of medications and even chemotherapy. And obviously, we know that chemo breaks down people. We've seen how it makes people feel and the pain they go through most of the times and the changes that they have to go through. Now you have diabetes and you have a cancer. How does that affect the treatment?
So there is a close link between diabetes and cancer, as I've mentioned, and even its treatment. So it's very important that we monitor you once you have the cancer. Once you have cancer and you have diabetes, close monitoring is very important in cancer management. In chemo, with people with cancer that have diabetes, the treatment is not vastly different. It's just that there is we closely monitor their sugar levels. Mind you, the chemotherapy medications as well as steroids that are given during cancer treatment also have a tendency to increase your blood sugar levels. I
was going to ask that. So it can affect your blood sugar level? Yes,
there is a link in that. So we tend to closely monitor their blood sugar levels during that and alter the therapy, tailor them to the treatments that they are supposed to receive.
So they can be fine?
Yeah, so at the end, you will
Please
be.
give me some hope. I need some hope here, because already having diabetes and having cancer and going through chemo already, therapy. Give me some hope.
Yes, definitely. The care over here is very good, and you will be monitored to make sure that there are no issues. So there are no cause for alarm. There is management that's available for those with cancers. I mean, ranging from the surgical approach where we cut out the cancer. To having radiotherapy, that is to use high frequency waves to kill the cancers, as well as the chemo drugs that can help also kill out the cancers.
That is why it's important to go to the hospital.
That is why it is important.
So it's detected early.
Early detection is very key.
Early detection saves lives, guys. It's very, very important. And then this is what this show has actually taught a lot of us, that early detection saves lives. Please, don't just watch the show and then you think you have all the answers. Go to the hospital. We're begging you. Wow, Doc. Whew, I've learned so much.
It's been a lot, yeah. I know.
I've learned so much. Little me have learned so much. But what is the tip of the day? I think there's a tip of the day, and yeah.
Okay, so the tip of the day is a steady blood sugar is powerful. Keep it controlled, and you lower your risk of diabetes, complications, and even some cancers. Small daily choices make a big difference.
Small daily choices make a big difference. I love that part of this tip, and I would like to remind you all that you should put it in your mind that those small daily differences are things like exercise, are things like eating right, are things like reducing your alcohol intake, are things like cut down on smoking. You can start little by little. Like if you used to go 5 sticks or 5 whatever rolls of whatever that you take, reduce it to say 3, then you come down to 2, then you come down to 1, then you stop. That's for people that can't cut it out easily. But just little steps will help you. Even if you have never exercised in your life, start by walking, start by moving your body, start by dancing. Start 5 minutes today, tomorrow 15, the next day you can see you're doing 20, next thing is 30, and that's it. So I think we need to take this thing seriously. Doc, where can people reach out to you? Like social media? Let us know.
Yeah, so I'm not very active on social media, but definitely if you want to reach my team is through Violet's Medical Center on all social media platforms. We have a very vibrant team, always ready to take care of you if you need any help or assistance health-wise. We are always ready available. And
the address of the place?
It's at Kwabenya, around the Musuku roundabout. Always readily available to be of assistance. All
right, thank you so much. Ladies and gentlemen, I hope you enjoyed this episode, because I really did, and I have taken a lot of nuggets. So please let people know, especially people with type 2 diabetes, they need to take care of themselves. And we've been speaking about type 2 diabetes and its link to cancer, and it has been very educative. Now, the doctor in the house was Dr. Efriye Bedu, medical officer at Violet's Medical Center. And my name is Chris Carter. See you next week for a new episode.